Coming up at the tail end of August, you got Floyd Mayweather and Conor McGregor who are going to fight. And I think a lot of kids watch boxing and they watch, frankly, mixed martial arts, and they want to do it. They want to participate in it. But what does it do to them as far as concussions are concerned? And should there be an age limit when you should jump into the ring? And what about the precautions? Lots of questions. Kate Delaney, NBC Sports Radio, NBCSportsRadio.com. Who better to have on the show to talk about that than one of my favorites? He's in our virtual green room right now, Dr. Philip Stieg from the Weill Cornell Brain and Spine Center, which is the leading neuroscience patient care center in New York City. And frankly, in my opinion, everything I've heard in the world. And Dr. Stieg, it's always a pleasure to have you on. And I think that more and more kids are getting interested in boxing, and maybe they always have been. But what are the dangers as far as concussions are concerned? So I guess, should kids box?
My personal opinion is that starting boxing before the ages of 16 is probably not a wise thing. We know that children are more prone to concussions. We know that children recover from concussions more slowly. And what we don't know, obviously, is what the long-term implications of repeated concussions are for children. We know in adults that repeated concussions can lead to chronic mental problems. So, anything that we can do to try to avoid that, I think, would be good. Yeah,
and what the argument would be, and you know this because you hear this from parents, and you'll hear about equipment, and geez, well, what about wearing this and wearing pads? But it's still your head being hit repeatedly, right? When the right jab comes in or somebody catches you with whatever they catch you with, whatever combination.
Well, certainly mixed martial arts is, it's pretty, pretty brutal in the sense that you're only wearing a leather mitt with no helmet. So it's really a direct blow, and you can kick and you can use your elbows. And, these are obviously bones striking your skull. And so it's not only the impact of the blow to the head, but it's also the fact that your head shakes within your skull as well. So it's what we call is a translational rotational injury to your brain. And that can happen in a child even if they are wearing the protective boxing gear during their sparring matches and even during the fights. So I think that we have to take precautions and avoid subjecting them to these risks for injury early on in life.
Yeah. Something I mentioned.
I would just say that in soccer they've eliminated heading until the age of 14. That's how specific they've gotten there.
Yeah, I was going to ask about that because I've had those conversations with some of these young women who are now in their early 20s who did do that with taking the ball to the head repeatedly and then had concussions, but still really, really wanted to play. And it brings up a bigger question, one that sometimes is talked about. Why are female athletes at greater risk? And are they at greater risk for concussions?
Well, it used to be thought that women were more likely to report the fact that they've had a concussion, but we just had a recent meeting between the Ivy League and the Big Ten, and curiously enough, the reported incidence of concussion is equivalent between the men and the women at that level of sport. What is usually thought about the mechanism of concussion for women is that their neck musculature isn't as well developed as it is in younger males, and their head proportion is bigger than the neck musculature. And for that reason, both of those reasons, they may be at slightly increased risk for developing a concussion, either from a direct blow or from the head shaking on a pendulum of the neck.
Yeah, and you talked about this. I'll tell everybody, you've got a great site too. If you go to the Weill Cornell Brain and Spine.org, and it's WEILL Cornell Brain and Spine.org, you've got a little video that you put up that I thought was so well done, where you talk about your own daughter who had a fall during a polo match. Explain what happened with her.
Well, she unfortunately got knocked off her horse and landed on her head, and she had a temporary loss of consciousness and a brief seizure immediately after the fall. Fortunately, she's fine and gainfully employed now. But that's certainly not the worst thing that can happen after a concussion. And then one has to remember also that concussion is part of a continuum, thinking about mild traumatic brain injury, moderate and severe. And you hope that you don't fall into the moderate and severe categories.
You know, it kind of brings up a good question, Doc. You and I have talked about this before because you play tennis and I'm an avid tennis player, and I've seen people go down and bounce on their head a few times when they're being super aggressive in a match, a country club match, no less, but they fall, and it always takes my breath away, and they kind of stumble at first, and then I think, boy, they should get that checked out. When you hit your head like that, isn't it smart to just go and get it checked out? I think some people blow it off.
Well, I think that, again, it's all varying degrees. If you strike your head and you lose consciousness, then for sure you should go get checked out. If you strike your head and you have a large laceration, it's probably worthwhile getting checked out. You would want to make sure that you don't have a skull fracture. The usual criteria revolves around loss of consciousness. Once you've lost consciousness, you should most certainly have it checked out. Then again, for elderly patients, say somebody that's 70 years old that falls down and bumps their head, they might want to be followed by a neurosurgeon or a neurologist because they can develop a problem called a chronic subdural hematoma with no obvious neurologic loss of consciousness at the time of the fall.
Yeah.
So there are different rules depending upon how old you are.
Yeah. When you talk about concussions and treatments and all of that, I mean, I would have to believe, and we've talked about this a long time ago, but there have to be great moments in your career where somebody came to you and they were just a wreck and you were able to put them right. And I know you've done this for many patients, but there has to be, I'd say, a few in your background that you could tell us about that. Wow, they came in, it was a nightmare, and now they're a walking testament to what we do and how we save a life.
Yeah, I mean, I think that the key component is that people in America want to turn on the TV station and turn on the channel they want and be instantly gratified. And fortunately, that's the case in the majority of concussions, that they get better within 7 days. But people with severe concussions can take up to a year, and I can think of one example where a patient was riding in a helicopter, and the helicopter crashed and sustained a number of bony injuries, but only a concussion. That being said, the individual had a very long period of time where they had difficulty with concentration. They were a professional writer by trade, and it took up to a year's time, and eventually that individual went back and won a Pulitzer Prize. So that was extremely gratifying.
Boy, no kidding.
Make the complete turnaround.
I bet. Are we going to see you? Are you going to be on the sidelines with the Giants again this year at home games?
Will be, and I'm looking forward to it. Hopefully we'll have a winning year there.
That's the way to be. Perfect. I'll make sure I send this little piece of tape to the Giants to get them riled up. Dr. Stieg, yeah. It's always a pleasure to have you on the show. Thank you so much.
Kate, good talking with you. Thanks. Bye-bye.
Yeah, he's the best. Dr. Philip Stieg, like he said.